Good afternoon. I'm Jack Duan. I'm founder and CEO of a company called Gliding Eagle. And thank you so much. Thank you so much, Milton, for this opportunity. So Dr. Peterson, he is a world-renowned internal medicine specialist of hepatitis. So we're going to talk about today just quickly about a real case, successful case. How can we do telemedicine from the United States to China or other emerging markets? Okay, so let's think about this. Telemedicine, when you guys talk about in the U.S., there's certain set of rules. When you actually go from the United States, go to other emerging markets, it's different set of rules, different set of challenges. So we'll talk about the two things. In order to focus on the best outcome for the patient, the two ingredients. The first ingredient is people, is a medical doctor, like Dr. Peterson. Another one is getting drugs there. We don't think about it. So if you have a diagnosis in the United States, you go to Walgreens, safely get a medication. You don't think about it. But when you go remotely, you go to another country, you can't get access to the right medication. Actually, it's a really big deal. So that's what we do, Gliding Eagle. We try to, using technology and different business model to help get the drugs there safely. So that's the problem we're trying to solve. And Dr. Peterson, maybe you can talk about the patient who are the first one who helped.
Thank you. I got to know Jack. It was so much fun being introduced to you, Jack, by a common friend of ours. And here we are with a patient who was diagnosed with hepatitis B. Now, I treat hepatitis B and hepatitis C in my private practice for 36 years. So I was excited about doing something international. So when Jack came to me, I said, yeah, I think we can do something like this because the treatment is the same no matter what the disease process is in terms of its location. We know that hepatocellular carcinoma is a problem. Second leading cause of cancer death in China. Third leading cause of cancer death in the world. The fastest leading cause of cancer death in America is hepatocellular carcinoma, believed to be caused by hepatitis C and hepatitis B. So here we have a 53-year-old female who presented with hepatitis B, and the next goal was, how do we go about getting drugs to this patient? Well, here we had a conference call. These are several doctors there, and there's me, and I'm just following the guidelines, American Association for the Study of Liver Disease, very specific guideline on how to treat hepatitis B. And I'm giving this guideline to them for the first time that they're being introduced to this guideline. So I have the records of the patient in front of me in terms of their liver problem, in terms of the level of hepatitis C virus in their bloodstream, and whether or not the patient have hepatocellular carcinoma in the liver, what's going on with this patient. So I have all this information, and we are sharing information. That's an interpreter to the far right, and it was a wonderful interaction. Go ahead.
So what this is a setup that happened is in China, we have a patient. So in China, it's before today, they don't have access to the latest drugs. When you don't have access to the latest drugs, also doctors do not know how to use them, right? So, but there are doctors in China. So Dr. Peterson provides second opinion to help those doctors there to get the knowledge using latest drugs, and we help to deliver. Just quickly, just to kind of give you what's happening today. For people who travel between here to China or other countries, sometimes your family, friend ask you to bring something in suit luggage. Okay, no problem with that. This is reality happens. So if you think about global trade, I think about, old days of camels, someone to know somebody. So if you think about the scale, it's the really quick, efficient way. It's smuggling. It's no way you can get close. It's really fast, right? You don't pay duty and tax. You don't have to worry about anything. You just wish nothing get caught. Just get over that. It's okay. It's just it's just a one way people are doing for thousands of years. If you think of the other side, it's extremely difficult. It's more heavier. It's really like you think about manufacturer had to get a drug registered in another country, all this stuff, right? So it takes about years to get there. So what we have done is we find typically every country have exception to get drugs there as long as you do all the paperwork and track the individual bottle can only be used by the individual person. That person cannot resell anything. Just like we're doing our taxes, we don't want to do it. Sometimes we want to do it. So in order to get a street bottle of the latest Hep B drug, go to the right patient. It took us 2 years preparation. Every documentation, we know how to do this. That is type of craft. We had to work with doctors and how to get there. So that's all the documentation. The first time we have done it is such a big deal. We laid everything out on the table. That is almost were our tax documents before April 15th. So when that happens, 7 days delivered, fully, everything fully done, duties are paid, and imagine that. You no longer have to smuggle something in, okay? You also don't have to wait a couple of years. So that's the new model called direct-to-user model. And as a tech company, so what our innovation is individually, every single bottle have a passport. You have to track that bottle to the end user. So there's no diversion, there's auditing trail. So that's important, that's our technology. That's by default. So this is one of the first time we actually have a true traceability from a pharmacy here to end user in another country. So please, you can tell about how we help that person.
Yes, this is the juicy part for me. Here we have a 50-year-old female presenting with hepatitis B issues. And one of the things that's also been tracked that Jack didn't mention is the paperwork. From there to me, I'm looking over the paperwork. And so here we have a patient who ALT is 58, should be around 30. Direct bilirubin is elevated. Anytime the direct bilirubin is elevated, you know there's some inflammation going on in the liver. And hepatitis B antigen is positive. E antibody is present, which is a good thing for the patient. The viral load was over 2,000. Here's the caveat to that. Viral load over 2,000. The ALT is 58. Female should be 25. Anything twice 25 is a problem, needs to be treated. So this patient have a 53-year-old history of probably hepatitis B, given that she probably got it during the birthing process. Well, here we treated the patient with Bimlidine. I was so glad that she was able to get this medication because now we don't have to worry about perhaps liver cirrhosis, liver decompensation, and liver cancer in this patient. So 9 months later, all the tests normalized in this patient. Hepatitis B viral load was undetected.
That's a good word. So sometimes, just kind of quickly, so glad I see I've had two more minutes. So one of the things I want to share that, when you do a telemedicine across the world, the most important thing is put the time in to earn the trust, right? We've been working on this for about 3 years before the first patient. We had to get to know the partner, the doctors, the patients in China. But once you earn their trust, they would just send the money through WeChat, mobile payment of over $10,000. They just, and after that, when they really feel that how much we really care about the well-being, and Dr. Peterson would have, and they came back, they keep coming back. Now that we were kind of shocked because the drug now is available in China for about 1/8 of the price in the United States. And the patients still come to us, they want to buy the drug from us. We don't sell drugs, but they want to get drug delivered from us because they feel this channel is the most trustworthy one. Everything is traceable, right? So what I'm trying to say is in terms of healthcare, so for the people who can afford it, right? For the people who, another attribute is that trust of quality services. In this case, a person and a bottle of pills that really help them. So thank you very much for this.
Thank you.
Any questions? I've got a question and comment. My name is Victoria Moy with Innovatio Health Design, and I actually spent 14 years in China up until a few years ago. I still go back every year for various reasons. And your story, this is great what you've been able to do. It is only for the rich. Only the rich can afford $10,000. The thing about, and I worked with many doctors, many hospitals there. There are a lot of great doctors there, a lot of very well-trained doctors. I'm sure you've met some of them. A lot of these drugs are available, just like you said. And it is the trust issue. So I wonder if there's a way to do this where you can spread out the joy. There's a lot of hepatitis there. Almost everybody in China has some, they have the antibodies. So I'm wondering, this is very specialized. And when I was living there, I also used some of the joint venture clinics. There are many joint venture pharma companies there. So I guess I'm wondering how, are you going to stay in this very specialized mode only for the rich, or what?
This is a great question. So the first, as entrepreneur, even though we have very idealistic to solve world problem, we have to be very humble to know we cannot solve all world problems. But you have to start with something. Just like Apple, you cannot believe them. They said one day they would take away all the Windows, right? They start with iPod. Only a few people can afford the iPod initially. So this is what you see iPod. The thing actually works, right? The next 5 years, that our intention is how to scale up in a way that is not typically consumer-driven directly. It's how you actually help to solve a lot of problems for manufacturers, product diversion problem. They're willing to lower the price almost 95% lower in those developing countries. But the problem for them is who can help those drugs stay there? They don't come back. There's lots of risks, so we're trying to address those problems. Then the next 5 years, you will see, we hope when it scales, when it really solves the industry problem, the cost will go down. So that's our intention. Today, you see the first version iPod, okay? 7 years later, you see iPhone.
Thank you so much.
My company is also doing cross-border telemedicine. We bring patients from China to United States. We also do video consultation, second opinion service. We got a lot of requests from our patients, especially cancer patients. They want the drugs, especially the targeted drugs for cancer. And we have a patient that, recently FDA approved a drug for NITK fusion drug, actually. So it's only available in the United States, and our patient want it. So I'm just wondering if your company can do anything for these kind of cancer patients.
Yes, we can, but this is, again, I'm very practical. So the problem with this is we really would choose hepatitis because the drug's efficacy is 98%. When you go to cancer today, it will kill us as a startup company. The risk is so high, right? We can't find someone like Dr. Peterson so courageous enough to say, I would help other patients. For most American doctors, they would not take those telemedicine. They can't write a prescription. So how do you get the drugs legally? That's a huge problem. You cannot walk into Walgreens to say, I want a drug. You have an American doctor give you a prescription for that. That's a legal liability. So when you think about everything done full compliant way, it's much difficult. We have intentions. We really don't have a solution right now, not in the short term. In the midterm, you say, we can directly work with Eli Lilly, Merck. When we can direct get a drug from the manufacturer, we do not need a prescription in the United States. Then we can get drug direct to China. But that we still haven't solved the problem. Have someone like Dr. Peterson that help another doctor to really use the drugs. That's also hard.
So Dr. Peterson, can I ask a question? So in that case, a hepatitis in there. So are you writing a prescription for that patient directly? The reasons I'm asking is I'm assuming you don't have a license to practice in China, so you're legally not able to write a prescription for the patient in China.
Boy, that's a bold move on my part, isn't it? to actually accept that challenge. Okay. Here you have a patient before you with clear indication for need for the medication, and the doctors say, I'm writing it for the doctors, more so than the patient. Yeah. So it's a doctor-to-doctor interaction, and I agree to such a medication. We find a pharmacy here that's willing to fill in this field and it's sent to the patient. The future, however, is to go through the pharmaceuticals. Okay. We know that Gilead is a big component of taking medicine directly to that country. So therefore, me writing a prescription will no longer be an issue. Yeah.
That makes perfect sense.
Yeah.
Thank you so much for this. Yeah. In fact, I think this is one of the, again, we get exposed to a bunch of different business models in there. I think the big thing for them is there's a couple angle to this. It'd be a huge economic, chain you're going to create. Thank you so much, Jack.